We have neglected mental health for many, many years. If you wanted help with your mental health, you'd go through an entirely separate door to the door that you'd go in for your physical health. And the consequence of that is that we've largely ignored mental health in the world of physical health, and we've ignored physical health in the world of mental health. And that means people with schizophrenia and so on die 20 years younger than other people, and why when you go into an acute hospital, there isn't really much recognition about mental health and its effect on physical health. The long-term plan has got a number of different sort of mental health components. There is, first of all, a big increase in funding for mental health, and the funding for mental health is going to outstrip percentage-wise the funding for physical health over the next 5 years. So that's quite an important change. So there's £2.3 billion that we're going to work up to, that's per year, and that will be spent on areas like improving community mental health services, making sure that we can deal with crises when they arise in the community and avoid the use of inpatient facilities where we can. We want to invest a significant amount more in children's mental health, which, to the extent that mental health's been ignored, the mental health of children has been ignored even more, I'm afraid. 50% of all adult mental health problems begin by the time you're 14, and 75% start by the time you're 22. You're going to get mental health help quickly. We're aiming to introduce access and waiting time standards, the same as we've got for physical health. The truth is that we know that there are psychological and pharmacological interventions and ways in which we can help people get back to work and so on, all of which has a good evidence base. So quick access, evidence-based treatments. We do have good evidence about treatments that work in mental health. You need to bear in mind that over the years, research in mental health has been neglected, innovation and research. So if I look at cancer and the spend on research in cancer per person with cancer, we're talking about £1,000 per year per person spent on research. And then you compare that to mental health and we're talking about a mere 10 pence. So 10 pence versus £1,000, we know we've got to innovate more in mental health. We've got 4 fellows that have joined the programme this time, and in each case I was very, very impressed with what they've come up with, and it's going to be our job to support them as they take their innovation forward, and I think this is important, that they themselves get all the support they can to develop themselves. Have confidence, recognise that you've got here because you've brought something, not just an innovation, but some talent that you've got yourself. And you know, it's always hard to see the future, but the future looks so much better in mental health now than it ever has done. And now is a great time for you to be coming to join us.